John Hook's Newsmaker Saturday starts now.
Thanks for joining us on Newsmaker Saturday. It's hard to believe 2 years ago this week, a man who had returned home to Snohomish County, Washington, near Seattle after traveling to Wuhan, China. He tested positive for the coronavirus on January 19th, 2020. It was the first documented case in the U.S. 24 months later, the number of people who have died from this disease in the U.S. exceeds 860,000. With Omicron now infecting so many people, immunity in the population is growing, and there are signs we may be nearing the end of the health crisis. 2 years later, what have we learned? What could we have done better? And is this really the end of the crisis? Is the end in sight? Dr. John Whyte is the Chief Medical Officer with WebMD. It's one of the top healthcare websites in the world. You've been kind enough to join us several times throughout this odyssey. Thank you again for joining us.
It is great to be with you. It is always invigorating to talk to you.
Likewise, Dr. Whyte. Thank you so much. What do you make of the setup that maybe we're closer to the end than many realize, that we may be nearing the peak?
I'll tell you, I'm optimistic about it. Even though we may be in for a couple of tough weeks ahead, I'm hopeful that this could be really the end of a pandemic and getting it more to that endemic phase where there's kind of this baseline, number of cases. And John, the reason why I think that is there's this concept of an immunity wall, and I think we're reaching that. Even in Arizona, we're about 60%, fully vaccinated. When you include those persons who have gotten Omicron, we're at this number where there's not any more people for Omicron to infect. And when they can't find a host, they can't continue to mutate and continue to thrive. So the irony is we may be in a much better position after all of this.
Dr. Whyte, it's amazing that maybe Omicron, when we look back, may have been the blessing, not a curse, because its lethality is far less than Delta or the earlier strain. Yet if you get Omicron, it may not kill you, but it may give you some pretty good immunity against what may come.
Well, what we're doing is we're replacing a more deadly, a more lethal variant, Delta, with a more contagious, infectious variant, Omicron, that isn't likely to kill you. If I asked you, John, 6 months ago, do you know many people that got COVID? You'd probably say, not that many. If I ask you now, we all know about 5 people who have Omicron. That just tells you how infectious it is. There's a joke going around social media. If you don't have any friends with Omicron right now, you don't have any friends. I mean, that just speaks to, we all know someone, don't we?
Yes.
So it speaks to it, and hopefully they're doing okay. So, this could be the beginning of the end, and I'm hopeful. We've had some curveballs with Omicron, so we don't know for sure, but let's try to follow what has happened in other pandemics, and this typically is the trend.
By the way, if jokes start to fly about coronavirus, then you know that something may be in the offing that's positive. By the way, in Maricopa County, where we are here in Phoenix, 1 out of 27 people in the last 2 weeks has Omicron.
Right.
That's a pretty big number.
I mean, we've seen more cases of COVID in the last few months than we've seen in the last 2 years. So that just speaks to how infectious it is. And we're lucky that it's not lethal like Delta has been.
Yeah, and here in Arizona, what we're seeing and across the country, yes, you're getting some hospitalizations. Emergency rooms are getting a lot of people, but ICUs are coming down. ICU beds are coming down. That means that people are getting this, but they're not getting really, really sick.
That's right. I mean, there's still about 60 deaths on average in all of Arizona per day, but proportionately compared to the number of cases that we're talking about, the denominator, it's much, much smaller than it has been in other peaks. Now, granted, we'd like those deaths to be zero, But it's important to keep all of this in perspective. You and I have talked about it over the past 2 years. We want to give people data, we want to give people information, but we don't want to scare them. We don't want them to get into this, mindset where, the sky is falling. I think we have to be cautious, we have to do the right things, but we have to get to a point where we weigh those risks versus benefits in our lives.
Yeah, Dr. Whyte,
continue to march on.
This is one of the reasons I've really enjoyed having you on the program, because I think you're a sober voice that's not hysterical about this. You've never kind of lost your cool about this and tried to keep it in perspective. One of the things that I wanted to ask you about, and we've talked about it before, our data on this is really surprisingly poor. We have a lot of people who are hospitalized with COVID, not because of COVID. In other words, they're in there for something else. They're routinely tested. They go, oh, the guy down in 3C's got a broken leg, but he tested positive for COVID. Now he's a COVID hospitalization. You also find out that the people who died, most of them had comorbidities of maybe 2, 3, or 4 comorbidities. They may have died from something connected to COVID, but not because of COVID.
No. John, I have to tell you, our data system is pathetic. We can't even count who's in the hospital and why, 2 years in. So, this is an area that I get very frustrated about, because we should be able to count this data, because it does matter to some degree whether you're in the hospital because of COVID or with COVID, right? So everyone in the hospital is tested for COVID, as they should be. But then let's figure out, when we're trying to figure out the lethality, the infectiousness of it, what's really going on. And we should be able to distinguish that. Now, granted, some people may come in with congestive heart failure, with diabetic ketoacidosis, and Omicron might have put them over the edge, right? So that's, it's kind of a mixed bag there. But can't we count, Greg?
This is what
John? This is what I'm so annoyed by. I was talking to someone earlier today.
Yeah.
It's just really frustrating.
It is, and I'm wondering, given that, do you think this mortality number, 860,000 in the United States, do you suspect that is wildly inflated?
I don't think that it's wildly inflated. It's probably not as accurate as it should be. There's probably people that have died at home that never came in, especially early on. But where we should be in this is, as I just point out, we should be able to count accurately, and we don't have those good numbers. There's no doubt that COVID has killed hundreds of thousands of people, that it has been, a serious pandemic, but we don't have the systems there to really understand, where we are today. And that's where it goes back to, we need that to help evaluate risk, to help make those determinations as to how we keep people safe. And why can't we do that? We should be able to do that. It's not hard.
No, and we seem to be right now, in terms of the vaccine, we're stuck at about 63%.
Yeah.
And people have had plenty of time to kind of size up whether they want this or not. I think we've reached the ceiling on that. With that pointed out, do you believe that we have understated the importance of natural immunity? People who have had this disease and recovered, and maybe they have decided, I've had it, I'm not going to get the vaccine because I've got natural immunity, which seems to be very, very important.
I agree with you 100%. We have reached our ceiling. 2 years in, we're not changing anyone's mind at this point. It's at the margins. And I think it was a mistake early on to kind of sell the vaccines as what we would call these sterilizing vaccines, where they eliminate, all cases. What we should have talked about, getting vaccinated is going to protect you from being hospitalized, hopefully, and dying from it. And we should acknowledge that there is natural immunity from getting COVID, and better assess, how that plays out. There was a lot of data early on that supports, if you had COVID and you got one shot, that might be enough, and that might actually be better protection. It's hard to sort all this out when you're in the middle of a pandemic. But we should have acknowledged that, because I think we created a lot of tension that was unnecessary about it. Sure, there is natural immunity from getting COVID. The challenge that comes up, John, is some people have a mild case of COVID, right? So they're not going to develop a lot of antibodies because they weren't that sick to begin with. Other people, are on their deathbed and survive, they're going to have a lot of protection.
We've got about 45 seconds left. I've got to ask you, do you think this in the end will be seen as a health triumph or a public health failure?
It's going to be a mixed bag. It is success when you think about where we are in vaccinations in the period of time, bringing a successful vaccine. We didn't get a chance to talk about therapeutics, Paxlovid, and some other medications that are going to be available. But it's also been a miss in terms of effectively communicating to the public about what they need to do and being consistent in that messaging. I mean, it's frustrating in terms of people want to do the right thing, but they're getting conflicting messages.
Yeah. Do you think we're ready for the next one? I mean, there will be one, but it does seem to be an every 100-year event, maybe.
Yeah. I'm not sure we're ready for the next one. Honestly, I think we have to improve our public health surveillance systems. We have to continue to make sure that we have, good ventilation systems. We have a lot of work to do to truly be prepared for the next pandemic.
Yeah, thank you so much. It's been great to see you again, and I appreciate you helping us out during the course of this.
Great seeing you as well.
Dr. John Whyte, WebMD. We're back in a minute on Newsmaker Saturday. How do you start a police department from scratch? We're going to talk to the new Queen Creek Chief of Police about how he did it, coming up next. Welcome back. How do you start a police department from scratch? Queen Creek is in the process of finding out. They're doing it. At the stroke of midnight, January 11th, Queen Creek's new police department rolled out for the very first time, the culmination of a 2-year plan, and they got it done. And I thought it would be fascinating to find out how you even begin to do this, especially in an era where police are increasingly being criticized, defunded, and second-guessed. Who better to talk about it than a veteran of law enforcement and the new police chief of Queen Creek, Chief Randy Brice, who's kind enough to join us. Chief, congratulations.
Thank you so much for having me. We appreciate the opportunity to be here.
Yeah, I am just so fascinated by how you guys put this together. Queen Creek's a city of about 70-some thousand, right? When you got, I guess the city council decided a couple of years ago that you needed your own police department. Can you give us a genesis of how that happened and where you get to a threshold where you say, Sheriff's Department can't do it anymore, we need our own people?
That's a great question. I think that's been probably one of the number one questions I get is about what actually started this. I think first and foremost, it's important to say that the Sheriff's Office, the Maricopa County Sheriff's Office, Sheriff Penzone have been an amazing partners to the town of Queen Creek, and the deputies have just done an incredible job. At the point here where the council really went to the community and said, hey, we're growing, we have lots of infrastructure that we're putting in, there's lots of changes coming to this small town. What is it that you want as a community? And so that really is what kind of started the conversation, and they looked at a couple different plans. Ultimately, they wound up with what I'm dealing with, is that they decided to start their own police department. So a few months after they made that decision, after meeting with a lot of the public, talking about what the expectations would be, what they wanted, they kicked it off, and a few months later they hired me in July of 2020, and here we are about 18 months later, and we're moving forward.
Does it help that you spent 20 some odd years with the Maricopa County Sheriff's Department, which was the agency servicing Queen Creek? Did that help?
Actually, it did. So I had a great career with the Sheriff's Office, spent almost 25 years, 24 and a half. And then I moved over to Gilbert for a short time where I served over there as an assistant chief. So I learned both county and municipal government. So I had a lot of background, almost 30 years in law enforcement by the time I came here. But the great thing about this assignment was when I was with the Sheriff's Office, this is actually where I worked for my last 3 years with the department. Yeah. So I got to really know and love the community. So that's really part of what brought me back.
Refresh my memory. Did this ever go to a vote of the people? Did the residents of Queen Creek have to vote on creating its own police force, or was it strictly the council came up with it?
So there was a lot of outreach and a lot of surveys and different types of touch points with the community. So the community never actually gave a vote for funding or anything of that sort. But the council did reach out to the community in a long period during that initial segment of discovering what they wanted. So there was a lot of community outreach, and I think it was a little over 60% of the community was in favor of moving forward with the police department. So a lot of touch points, but not an official vote from the community.
Chief Brice, is there a point, a population trigger point where cities say or towns say, okay, we're at this number, it's time to have our own force? Is it black and white like that, or is it kind of a judgment call?
Yeah, so I think a lot of people do think of just a population, there's a magic number. There's not. I think that's one factor we look at, but you're really looking at the complexity of what's happening. And from the perspective of the sheriff's office, were they able to fulfill all the needs that the community was actually looking for? So the council really did look at a lot of different things. They had consultants in helping them understand some of those numbers, some of the statistics, and the complexity of law enforcement in general. And you really, I think the tipping point is when the community wants a specific type of service, and they really, in this case, they wanted to have their own police department that really would be responding very quickly in real time to what their needs were. And I think that was the trigger for this community, and I think it was a good move, and we've seen a lot of great feedback already from that. So
you came on board 2 years ago. Were you hired pretty quickly after they decided to do this?
Yeah, I believe it was March. They made the vote in 2020, and 2020. In July of 2020. Yeah, I came on board, so about 18 months.
Okay, so peel the onion for me. What was the first thing you did?
So other than checking to see why I volunteered for this amazing and difficult assignment,
be careful what you wish for, Chief, right?
Yeah, all the chiefs in the valley pretty much said that to me. So, but what a historic moment and an amazing opportunity for me. But I'll be honest, it was a little scary, very daunting. We're in the middle of a pandemic. Our supply chain issues weren't as bad as they eventually became, but they already started that way. So when you're thinking about some of the big things that we have to buy, vehicles, computers, anything has a chip in it, that was becoming very difficult on day one for me. So the town had a plan, at least a skeleton of a plan for me to start working with, and then it was just rapidly moving through all of the equipment and materials that we needed, getting that ordered as soon as possible, and going through hundreds and hundreds of agreements, contracts, and hiring. Hiring was a critical component because you're really on timetable when it comes to all the processes that you have to do. There's a lot of hoops to jump through to make get a police officer in Arizona.
So you come in March of 2020. That was when you started?
July of 2020.
July of 2020. Okay, so making it even tougher, I believe it was May 25th of 2020, George Floyd is killed in Minneapolis at the hands of Derek Chauvin and the other officers. How did that affect trying to hire officers when we were in the midst of daily, nightly police protests?
So very challenging. I'll say the number one thing that was in my favor is that this community is extremely supportive when it comes to law enforcement and public safety. So that really helped me move along. But you're right, that national conversation really drove how we looked and approached our recruitment. And I think the one reason we were really, really successful is that from the very beginning we decided that the most important thing that we would do is create a connection to the community. And so all of our recruitment, all of our efforts, all the ways that we reached out to people that we wanted to bring in here, that was really the framework that we put together. Was if you want to come here and really be the kind of officer that will connect with the community, and that's your number one focus, this is the place to be.
Do you want your officers to live in Queen Creek? Is that part of the deal?
So it's not a requirement, but it certainly is a plus. I moved to Queen Creek. I was a Gilbert resident, but I moved to Queen Creek when I took the job. I think it's important to be part of the community, and although we don't require our officers to all live here, there's quite a few that live very close or in the community.
I think that's a good thing. I mean, I know some departments require it, others don't, but that's a nice touch. Did you have to poach, for lack of a better word, officers from other jurisdictions? And did you have the pay structure to be competitive in that? Or how many did you get from the academy versus grabbing officers from other departments?
So in total, we on day one we had 64 authorized sworn positions, and 5 of those, actually 6, we put in the academy, which takes a little over a year to get everything done by the time you're hired and get through all the training. So they're really not viable to me yet. They're still in training. So most of our people came from laterals. About 75% were in-state from Arizona law enforcement agencies, and it's all over the place, not just the Valley, all over the state. We hired people, and then about 25% came from out of state, several different states, all the way to Midwest. To New York. We hired people from a 24-man department all the way up to a 40,000-man department from New York Police Department. So quite the gamut.
Yeah.
But we looked at it and structured it in a way we want to get the best experienced officers, but not all in just one category. So we have people that have 2 years all the way up to 20 years.
Do you have a SWAT team?
So right now we're a member of the regional SWAT team with Pinal County, and we'll be working in the next few years to build our own tactical operations team that will be a kind of a part-time team similar to what Gilbert and Chandler uses.
Do you guys, is everyone outfitted with body cameras, or is there just not the money for that yet?
Now, a great question. This town has really been supportive when it comes to funding. That was one of our #1 goals, was to make sure that every officer had a body cam. So absolutely, we're starting day one with a body cam.
You did that right away. This was no small feat. I think this was $19 million to get this up and running, right?
Yeah, some of that is a combination of the last part of the contract with the sheriff's office, but yeah, total budget for this past year was a little over $19 million. That includes all of our capital infrastructure, the rest of the contract with the sheriff's office for 6 months, and then all the things that we needed to get and personnel costs. So yeah, it was quite the feat.
And Queen Creek was paying the sheriff's office, I think, about $6 million a year for coverage, right?
Yeah, it was about $9 million a couple of years ago, and then because of the shortage in staffing, it kept being decreased just because they couldn't meet the staffing requirements.
Now, with your own department, do response times go down immediately?
So we've been very lucky so far. We've had great response times, and we're going to continue to staff. We staff a little bit different way. So we have overlap shifts. So there's during peak hours, we have more people on the road than the sheriff's office was able to do. So yeah, our goal is to make sure our response times, especially emergency and urgent calls, are very, very low. And it's only been 9 days, but we seem to be very successful so far.
Okay, Queen Creek, I mean, it's a really great spot. People love it who live there. What is your biggest crime problem in Queen Creek? Or do you have one?
So that's the great thing about this community. It's got a very low crime rate. But that's not to say that we don't have crime, and that's an important part. We have property crime, we have violent crime, but it is such a low rate that this is an extremely safe community. But we always caution our residents to make sure they're doing all the things to make sure that they stay safe. But it's a lot of quality of life issues. Our probably #1 problem is traffic.
Really?
As I mentioned in several other, is that we have tons of people moving through our community to get to work. So we have a big traffic issue.
Okay, now Chief, don't tell me you're going to start the photo radar stuff, are you?
No, we are not a fan. Council is not interested in that at all.
Good for you. You're not a fan.
I'm not.
Tell me why. I'm curious.
Well, we're about changing behavior and keeping the roads safe. And I know there's statistics out there that say that those things do have an impact. But I'd rather spend the money on my officers who can make great decisions on the fly and work with people in a variety of situations and make great decisions and be able to move around as necessary. Just this last 7 days, we've been out and really working hard to keep the roads safe, and we've already reduced accidents. I don't have quite all the numbers yet, but we've seen anecdotally a drop in those. But we've issued, I think, our first 7 days, it was 150 warnings and only a few tickets. That was our goal, is just to, hey, get people used to, we're going to be out here, we want to keep people safe. But I think the officer touch is more of that customer service piece that we're looking for, and I think that's what the community wants.
No doubt, and the officer has judgment that the camera doesn't have.
Exactly.
I'm with you 100%. Chief, best of luck to you and the force. I know it's been challenging, but what an opportunity. It's really an interesting exercise you're going through, and I wish you the best of luck.
John, thank you so much for the time, and we love our community, and please come visit us. It's a great place to be.
I will, and I'll try not to speed, Chief. Thank you. Chief
John.
Randy Brice. It's great stuff. We're back in a minute on Newsmaker Saturday. Thanks as always for joining us on Newsmaker Saturday. By the way, people ask all the time, how do I find a prior show? I saw a guest, I want to see it. Just open up your phone app, get it on that QR code in the middle of your screen, and it will take you right to the website, fox10phoenix.com/newsmaker, or you can just type it out and go there yourself. Hope you enjoy the program. I certainly did, and we will see you next week on Newsmaker Saturday.